Hi, my name is Margaret Brown, and I am an occupational therapist with experience practicing in a variety of settings. Currently, I am a staff associate at Econometrica in Bethesda, Maryland. I will be presenting the Section J Pain Interview Workshop. During the coding exercises included in this workshop, you may wish to reference the Pain Assessment Interview in the MDS RAI 3.0 version 1.18.11 and your practice coding reference packet. This coding workshop will focus on the following pain assessment interview data elements, which are new to the MDS RAI 3.0 version 1.18.11. J0510, pain effect on sleep. J0520, pain interference with therapy activities. And J0530, pain interference with day-to-day activities. We will start by coding some examples for J0510, pain effect on sleep. We'll code two practice scenarios for this new data element. For J0510, code for pain effect on sleep over the last 5 days. This visual demonstrates how to code this data element based on the resident's response. If the resident responds that pain has rarely or not at all made it hard to sleep over the past 5 days, code 1, rarely or not at all. If the resident responds that pain has occasionally made it hard to sleep over the past 5 days, code 2, occasionally. If the resident responds that pain has frequently made it hard to sleep over the past 5 days, code 3, frequently. If the resident responds that pain has almost constantly made it hard to sleep over the past 5 days, code 4, almost constantly. If the resident is unable to answer the question, does not respond, or gives a nonsensical response, use code 8, unable to answer. Consider the following scenario. A resident is admitted to the SNF for continued care after a 10-day stay in the acute care hospital for the repair of a right hip fracture resulting from a fall. A nurse is completing the admission assessment. The admitting nurse asks the resident, over the past 5 days, how much of the time has pain made it hard for you to sleep at night? The resident responds, the pain was unbearable at the hospital last week, and I wasn't sleeping. I know that I was on a lot of medication there, but now I'm not sure what day it is. Is this Saturday? The nurse replies, yes, today is Saturday. Can you recall when your most recent episode of pain was? The resident says, no, I really cannot remember. After indicating that they cannot recall when their most recent episode of pain was, the resident says that they do not want to discuss this any further. How would you code J0510? A, code 2, occasionally. B, code 3, frequently. C, code 4, almost constantly. Or D, code 8, unable to answer. I'll give you some time to think about this. And it looks like most of you selected D. That is correct. The answer is code 8, unable to answer. The resident reports that pain has been present, but is unsure of the day and cannot fully recall the last 5 days. The nurse reorients the resident to the correct day and prompts them to think about the most recent episode of pain to try to determine whether it occurred within the look-back period. Despite this, the resident is still unable to remember. Since the resident is unable to remember and does not wish to discuss this any further, the most appropriate response is code 8, unable to answer. Let's move on to another practice scenario for J0510. A resident is preparing for discharge from the SNF after recovering from a major automobile accident and subsequent right lower lobe pneumonia. During the discharge assessment, the resident is asked by the nurse assessor, over the past 5 days, how much of the time has pain made it hard for you to sleep at night? The resident responds, some nights I have a really hard time sleeping due to my pain, especially when I have done too much during the day. On those nights, I need to ask the nurse for additional pain medication before I can get back to sleep. What should the nurse assessor do next? A, code 2, occasionally, as the resident reported having pain only on some nights. B, code 3, frequently, since it sounds like the resident was awake a lot due to pain. C, narrow down the resident's response by asking additional follow-up questions about the frequency of pain. Or D, code 8, unable to answer. I'll give you some time to answer. And it looks like about 63% of you selected C, a number of you selected A. The correct answer is C, narrow down the resident's response by asking additional follow-up questions about the frequency of pain. Since the resident's initial response did not lead to a clear answer, the assessor should narrow down the response by asking additional follow-up questions about the frequency. Therefore, the correct answer is narrow down the resident's response by asking additional follow-up questions about the frequency of pain. As a follow-up, the nurse asks the resident whether they would consider this pain to have occurred occasionally or frequently over the past 5 days. The resident responds, I guess I would say occasionally, since it only happens now and then. How would you code J0510? A, code 1, rarely or not at all. B, code 2, occasionally. C, code 3, frequently. Or D, code 4, almost constantly. I'll give you some time to select a response. And it looks like almost all of you selected B. That's correct. The answer is code 2, occasionally. The reason for this answer is because upon further clarification by the nurse, the resident selects a designated response option and reports that over the past 5 days, pain has occasionally made it hard for them to sleep at night. Therefore, the correct answer is code 2, occasionally. Next, we will move on to coding examples for J0520, pain interference with therapy activities. We will attempt 2 practice scenarios related to this new data element. The coding instructions for J0520 are as follows. To complete J0520, code for pain interference with therapy activities over the last 5 days. As a reminder, for this data element, rehabilitation therapy is defined as special healthcare services or programs that help a person regain physical, mental, and/or cognitive, thinking and learning, abilities that have been lost or impaired as a result of disease, injury, or treatment. This can include, for example, physical therapy, occupational therapy, speech therapy, and cardiac and pulmonary therapies. This visual demonstrates how to code this data element based on the resident's response. Code 0 does not apply if the resident responds that they did not participate in rehabilitation therapy for reasons unrelated to pain. For example, therapy not needed, unable to schedule, over the past 5 days. If the resident responds that pain has rarely or not at all limited their participation in rehabilitation therapy sessions over the past 5 days, code 1, rarely or not at all. If the resident responds that pain has occasionally limited their participation in rehabilitation therapy sessions over the past 5 days, code 2, occasionally. If the resident responds that pain has frequently limited their participation in rehabilitation therapy sessions over the past 5 days, code 3, frequently. If the resident responds that pain has almost constantly limited their participation in rehabilitation therapy sessions over the past 5 days, code 4, almost constantly. Code 8, unable to answer, if the resident is unable to answer the question, does not respond, or gives a nonsensical response. Consider this practice scenario for J0520. During the first week in a SNF, a nurse is completing the admission assessment and asks the resident, over the past 5 days, how often have you limited your participation in rehabilitation therapy sessions due to pain? The resident reports, I developed an infection in my foot and started intravenous, IV, antibiotics about 3 days ago. My doctor says that therapy will not start until this infection gets under control. What should the nurse assessor do next? A, code 0, does not apply. B, code 1, rarely or not at all. C, code 8, unable to answer, since the resident obviously has some confusion due to their infection. Or D, check with the resident again tomorrow to see if the IV has been removed and therapy has started. I'll give you some time to think about this. And it looks like most of you selected A. The correct answer is A, code 0, does not apply. The resident reports that they have not begun receiving rehabilitation therapy due to a foot infection and IV therapy. Therefore, the most applicable response is code 0, does not apply, since the resident is not participating in rehabilitation therapy for reasons unrelated to pain. Let's try another scenario for this data element. A resident with a history of osteoporosis has recovered from a spinal compression fracture and is about to be discharged from the SNF. The resident will be receiving outpatient therapy services after discharge. Staff have reported observing the resident experiencing a lot of pain during therapy sessions at the SNF. The assessor reads the question and response choices as written. The resident responds, I have been able to go to therapy for most of my time here. I can recall only one instance in the past 5 days when the pain in my back was so severe that I had to limit my participation in therapy. The assessor confirms, the pain in your back limited your participation in therapy only one time in the past 5 days. If you had to choose an answer, would you say that you have limited your participation in rehabilitation therapy sessions due to pain, rarely, or occasionally? The resident responds, rarely. How would you code J0520? A, code 0 does not apply, since the resident will be receiving therapy as an outpatient. B, code 1, rarely or not at all, as this best describes the resident's response. C, code 2, occasionally, to be safe because the resident may have forgotten pain episodes and underreported their pain. Or D, code 4, almost constantly, because you have heard from other staff that the resident has had much more pain than they are mentioning. I'll give you some time to consider this. Great, and it looks like almost everyone selected B, code 1. That is the correct answer, rarely or not at all, as this best describes the resident's response. The resident reported that pain limited their participation in therapy only one time in the last 5 days, and indicated that they would say they have rarely limited their participation in rehabilitation therapy sessions due to pain. Therefore, the correct answer is code 1, rarely or not at all. Note that J0520 assesses pain interference with therapy over the past 5 days. It's important to understand that this item should be coded based on the resident's interpretation of the provided response options for frequency. Let's move on to J0530, pain interference with day-to-day activities. We will code a few scenarios for this new data element. The coding instructions for J0530 are as follows. Code for pain interference with day-to-day activities over the last 5 days. This visual demonstrates how to code this data element based on the resident's response. If the resident responds that pain has rarely or not at all limited their day-to-day activities, excluding rehabilitation therapy sessions, over the past 5 days, code 1, rarely or not at all. If the resident responds that pain has occasionally limited their day-to-day activities, excluding rehabilitation therapy sessions, over the past 5 days, code 2, occasionally. If the resident responds that pain has frequently limited their day-to-day activities, excluding rehabilitation therapy sessions, over the past 5 days, code 3, frequently. If the resident responds that pain has almost constantly limited their day-to-day activities, excluding rehabilitation therapy sessions, over the past 5 days, code 4, almost constantly. Code 8, unable to answer, if the resident is unable to answer the question, does not respond, or gives a nonsensical response. For our first practice scenario for this data element, a resident is preparing for discharge after a prolonged SNF stay following a total knee replacement with subsequent joint infection. During the discharge assessment, the nurse assessor asks the resident, over the past 5 days, how often have you limited your participation? How often, have you limited your day-to-day activities, excluding rehabilitation therapy sessions, because of pain? The resident replies, most days I can do what I want to do, though I was disappointed that I couldn't attend the resident and staff Memorial Day celebration last week, as I was having some pain on the day of the event. I still have pain in my knee from the surgery. Some days are good and others are more difficult. I'm not sure. I would say that pain limits my day-to-day activities occasionally to frequently. The assessor asks if the resident is able to narrow down their response choices, but the resident indicates that they are not. How would you code J0530? A, code 1, rarely or not at all. B, code 2, occasionally. C, code 3, frequently. Or D, code 8, unable to answer since the resident could not select a specific response. I'll give you some time to choose a response. And it looks like we have a little bit of a mix here with some folks choosing code 3 frequently and then a larger group choosing D, code 8. The correct answer is C, code 3, frequently. The resident reported that knee pain kept them from participating in a holiday celebration at the facility, and that their pain has occasionally to frequently limited day-to-day activities. Since the resident could not decide between 2 frequency response options, the assessor should code for the option with the higher frequency. In this case, the correct answer is code 3, frequently. We will now attempt another practice scenario related to this data element. A resident was transferred from the acute care hospital and has been in the SNF recovering from an episode of congestive heart failure. The resident also has severe rheumatoid arthritis. The nurse is completing the admission assessment and asks the resident, over the past 5 days, how often have you limited your day-to-day activities, excluding rehabilitation therapy sessions, because of pain? The resident replies, I try to do as much as I can throughout the day and get out of my room, but I need to stop often and catch my breath. My feet are swollen and ache, and my joints hurt almost all the time, so it's hard to walk. Between my feet and joints, I always have pain that almost constantly limits my day-to-day activities. I don't like taking the pain medication, so I tend to decline when the nurses offer it. How would you code J0530? A, code 1, rarely or not at all. B, code 2, occasionally. C, code 3, frequently. Or D, code 4, almost constantly. I'll give you some time to answer. And it looks like most of you selected D, code 4. That is correct. The answer is code 4, almost constantly. The resident reported that although they try to be active, pain related to their rheumatoid arthritis and their swollen, achy feet almost constantly limits their day-to-day activities. Therefore, the correct answer is code 4, almost constantly. Let's move along to our final practice scenario. A resident with a diagnosis of debility, Parkinson's disease, and dementia was recently transferred to the SNF from an acute care hospital after experiencing a fall at home. The resident is sometimes able to respond to questions. Staff report that the resident has seemed to be in a lot of pain since arriving. The resident's daughter has also stated that their father seems to be experiencing a lot of pain since arriving to the facility. The assessor, completing the admission assessment, asks the resident, over the past 5 days, how often have you limited your day-to-day activities, excluding rehabilitation therapy sessions, because of pain? The resident responds, I want to go home. The assessor repeats the question in order to attempt to obtain a response. However, the resident repeatedly states that they want to go home and then becomes agitated. The assessor is unable to obtain a response from the resident. The resident's daughter, who is present during the assessment, reports that their father has frequently been complaining of pain. How would you code J0530? A, code 1, rarely or not at all. B, code 2, occasionally. C, code 3, frequently. Or D, code 8, unable to answer. I'll give you some time to think about this last question. And it looks like most of you selected D, code 8. That is correct. The answer is D, code 8, unable to answer. The resident was unable to select a response, so the correct answer is code 8. Remember, this item should be coded based on the resident's interpretation of the provided response options for frequency. Interview allows the resident's voice to be reflected in the care plan. Information about pain that comes directly from the resident Provide symptom-specific information for individualized care planning. This concludes our coding scenarios for the pain assessment interview data elements. For additional information, we encourage you to review the material in the Section J recorded session, which is in Part 1 of this training program, and to refer to the MDS 3.0 RII version 1.18.11 guidance manual. Let's review a few key insights from today's presentation. The Section J pain assessment interview data elements, J0510 through J0530, are new to the SNF setting. These data elements assess the effect of pain on sleep, pain interference with therapy activities, and pain interference with day-to-day activities. Code the pain assessment interview based on the resident's interpretation of the provided response options for frequency. If the resident is unable to decide between two response options, then the assessor should code for the option with the higher frequency. Thank you very much for your attention. We will go over some Q&A for Section J before the break.
Thank you, Margaret. Our first question is, what is the look-back period for the pain assessment interview items J0510, J0520, and J0530?
Thank you, Lisa. The pain assessment interview, which includes items J0510 through J0530, asks the resident to recall pain in the past 5 days. Staff should conduct the pain assessment during the 7-day look-back period. The resident's response should be based on their pain recall in the last 5 days.
Question 2, can a chart review be used for coding the pain assessment interview items? For example, if the resident is unable to recall how much pain interfered with their sleep, therapy, and day-to-day activities?
As stated in the steps for assessment for the pain assessment interview, directly ask the resident each item in the pain assessment interview in the order provided. Use other terms for pain or follow-up discussion if the resident seems unsure or hesitant. Some residents avoid use of the term pain, but may report that they hurt. Residents may use other terms such as aching or burning to describe pain. If the resident chooses not to answer a particular item, accept their refusal, code 8, and move on to the next item.
And for our third question, how should you code the pain assessment interview if staff reports of a resident's pain directly conflict with what the resident states regarding their pain?
Good question. Data elements J0510 through J0530 should be coded based on the resident's interpretation of the provided response options for frequency.
And our last question, in J0510, pain effect on sleep, if a resident reports that they cannot remember their pain experience, and then later states they don't want to discuss it any further, should the nurse continue to ask the resident probing questions about the resident's recall of pain?
Per the steps for assessment for the pain assessment interview, if the resident chooses not to answer a particular item, the assessor should accept their refusal, code 8, and move on to the next item.